Buenos días, mi nombre es Ana Isabel Nieto. Soy la
Good
directora
morning.
del
My
Programa
name is Ana
Nacional de
Isabel
ITS,
Nieto.
VIH,
I'm the
SIDA en El
director of
Salvador.
the STD and HIV/AIDS
Gracias por
National
permitir
Program in
compartir
El
la
Salvador.
experiencia
I
de
want to
nuestro
thank you for
país
the
en la respuesta
opportunity of
nacional
sharing
al
our experience
VIH.
of HIV/AIDS response. So you know a little about us. El Salvador is the smallest country in America, and it's located in the heart of Central America, between North and South America. Our territory is just over 20,000 square kilometers, with a 6.3 million population, making us one of the most populated countries in Latin America. Talking about HIV, our first HIV detected case was in October 1984, and to date, we have accumulated 29,788 cases. Over the past 5 years, we have reduced from 7 cases daily to 4 cases per day. Basically, there's not a single place where we don't find at least one HIV case. What's our experience in multisectoral response? Around HIV, we have the National Against AIDS Commission, CONACIDA, the CCM, the Ministry of Health as directing agent, the international cooperation that has aligned with our strategic program, and of course, key factors in our response are people who live with HIV and some civil society organizations.
Esto también nos permite un compromiso y una voluntad.
This allows us to have a commitment and political will from our authorities for the national response, mainly from our Madam Minister, Dr. Maria Isabel Rodriguez, who has worked exhaustively with the program to incorporate it to the national agenda.
Se discuta en la agenda nacional.
We have subcommittees from the AIDS committees in monitoring, legislation, and technical committees. The communication issue is really important for us. In addition, we have legal technical instruments that allows us to have a response from many angles for HIV. We have a national law of HIV, a monitoring and evaluation program, a national strategic plan, administrative manuals, guidelines for the treatment of people with HIV and the most likely to be in risk population. We have built an institutional capacity that lets us collect information. We have a unique monitoring and epidemiologic surveillance system. Also, we have worked hard for a medical international supply, which has been very critical in response. And we have increased the staff capacity not only on a clinical level, but also for warehouses and pharmacies, and every aspect in the health system. Naturally, we have to increase the amount of supplies so we can have a more efficient staff, from technical aspects to the actual staff development. As far as the cooperation concerns, we have formulated basing on the National Multisectoral Strategic Plan 2011 to 2015. Every foreign help has been aligned with this strategic plan. And of course, we guarantee the monitoring and evaluation for the activities that we do. There is a diagnosis of the country's HIV response made by expert evaluation of the Global Fund. In 2011, we were invited to give a proposal based on the Strategic National Plan. Then we had another experience with the Global Fund to consolidate the 2 subventions that we were executing, the Round 7 Role Continuation Channel, called RCC, so we could make just one subvention. After we consolidated, we were invited again by the Global Fund to submit the concept note, early application based on the new funding model that we did in record time. We got the invite on February 28th, and by March 4th, we were already working on this concept note that we sent on April 6th. This has allowed us to negotiate that the proposal was accepted based in this new funding model.
También ahora nos encontramos trabajando en la conducción de una propuesta regional para la
We are now
eliminación de la
working on a
malaria
guideline
en
for a regional
Mesoamérica y la
proposal
isla
for the
española.
elimination of malaria
Esto,
in
El Salvador
Mesoamerica
preside
and the La
el
Española
mecanismo
Isle.
de coordinación regional y
El
esto es lo que nos
Salvador
ha permitido
precedes the
conducir
experience
esta
required in
propuesta
regional
con la
proposal
experiencia que
because of the
ganamos con
NFM
la
proposal we did early
MME.
this year.
Los resultados de la cooperación, no solamente con el Fondo Mundial, sino que con la Organización
The
Mundial
results
de
of
la
the
Salud.
cooperation, not
Hemos
only with the
tenido
Global
la
Fund,
evaluación
but
de
with the
país
World
con la
Health
misión
Organization,
2.0,
we've had the country
para la
evaluation with Mission 2.0
definición
for the
de
definition
acciones
of
estratégicas,
strategic
sobre todo en el
actions,
tema de
especially in
antirretrovirales. Con
antiretrovirals.
PEPFAR tenemos un marco de
With PEPFAR,
cooperación
we have
regional
regional
que también
assistance
nos ha
that has
permitido
allowed us
fortalecer
strengthen the supply
toda
in
la
health
parte de
system,
abastecimiento, sistemas
strategic
de salud,
alliances,
información estratégica. Y con el Fondo Global hemos
and with the
tenido
Global
también
Fund,
el
we've had the
apoyo
support with
para
human resources, of
contar con
qualified
recursos
staff that not
humanos
only works with
que
people with
brinden la atención
HIV,
no solamente a las personas con VIH, sino que en diferentes áreas del sistema de salud,
but in
en la
different
entrega de
health
equipos,
departments, in
entrenamientos,
delivery equipment,
investigaciones. Esto
training,
lo hemos hecho
research.
gracias a
This
la
has been
colaboración del
possible
Fondo
thanks to the
Mundial.
Global Fund.
Para
For us, the
nosotros, el
Global
Fondo
Fund is
Mundial
really
es muy
important
importante
because it
porque
gives
nos
us a
da la
chance
oportunidad de, no solo
not
para el
only for the
Ministerio de
health
Salud, sino que
ministry,
para
but
otros
other
sectores
national
del gobierno
institutions
nacional,
to
que
cover up the
podamos
gaps
cubrir
that
las
we have
brechas que
identified
tenemos
within the
en
strategic
cuanto
plan.
a las acciones que tenemos identificadas dentro del plan estratégico y en la dinámica de trabajo para que la sociedad civil
And as far as the
crezca,
work
se
dynamics
empodere
goes,
y
the civil
trabaje
society
en torno a la
grows,
respuesta
gets
nacional,
empowered,
sobre todo
work in
con las
response of the
poblaciones de
national
mayor
need,
vulnerabilidad,
mostly with the most
en el
vulnerable
marco del
population.
respeto a los derechos humanos y a la
Within the
toma de
human
decisiones
rights,
y la
the decisions, and the
participación
active role of this
efectiva de
sector.
todos estos sectores. En esta lámina quiero presentar todo lo que ha sido nuestro recorrido en este nuevo modelo de aplicación temprana.
Here I would like to present our road in this early application program. We received the invite on February 28th. We worked on the conceptual note from March. We had the company of the Global Fund team from many countries so we could polish our proposal.
Pulir, por así decirlo, nuestra propuesta. La entregamos el 1 de mayo. Fuimos notificados que el panel de revisión técnica la había
We were
aprobado.
notified on May 1st that the technical panel had approved our proposal. In May, we worked on the development of the purchase plan according to this new model. Practically on June 3rd, we got the news that our proposal was approved by the GAC.
Propuesta fue aprobada por el GAC y lo que en su momento fue una invitación para que
What began as an invitation to make a proposal for $17 million properly justified and certified that we presented it ended up as an approved proposal for $26.9 million that we will begin to use in 2014.
A ejecutar en el año 2014. Esta propuesta está destinada en un 50% a la atención de las poblaciones en mayor
This proposal is
vulnerabilidad,
destined
hombres que tienen sexo con
50% to
hombres,
attention
trabajadoras
the
sexuales
most vulnerable
y,
population,
personas
men that have
transgénero,
sex
que es
with
donde
another
se
man,
concentra nuestra epidemia,
sexual
porque si
workers,
queremos
and
ser
transgender
eficientes
people.
en nuestro
That's where
trabajo,
all the
debemos
epidemic
de
is condensed.
enfocar
And so that we are
nuestros esfuerzos
efficient in
en
our
esta
job, we
población.
have to focus on these people the
Como
most.
recomendaciones para la respuesta al
The
VIH en El
recommendation for
Salvador,
HIV
lo más
response in El
importante
Salvador,
es
the most
conocer la
important thing
epidemia,
is to know the epidemy,
identificar las brechas,
identify the
incluir
gaps,
a los
and include
tomadores de
all the
decisiones en el
stakeholders
análisis
in
de
the
la
analysis of
la
information,
toma de
decision
decisiones y la
making,
rendición
and
de
accountability
cuentas, que esto es
that
muy
is vital,
importante, y
and maintain a
una
good
buena
communication,
comunicación y
openness, and
transparencia
transparency
con
with all the
todos nuestros
donors and
donantes y
recipients.
nuestros beneficiarios. Muchísimas gracias
Thank
por
you very
permitirme
much for letting me
compartir
share
esta
this
experiencia
experience
con
with you.
ustedes.